Welcome to the Breast of Everything podcast. I'm your producer, Kim Schott, and I've got an exciting guest that I'd like to introduce you to this evening. This evening, joining us with Dr. Gold is Melissa Groves Azzaro. She's a registered dietitian, nutritionist, as well as a licensed dietitian. She's an award-winning women's health dietitian and founder of the Hormone Dietitian, an integrative health practice that helps busy women with hormone imbalances, PCOS, and fertility issues regain regular, symptom-free periods and get pregnant naturally. She uses a functional medicine approach to identify the root causes of your symptoms and develop a personalized nutrition, supplement, and lifestyle plan to balance your hormones and optimize your fertility. Melissa's website is thehormonedietitian.com, and Melissa works virtually with clients in the U.S., in one-on-one and group programs. She's also the creator of the PCOS Root Cause Roadmap, the author of A Balanced Approach to PCOS, and host of the podcast, Hormonally Yours, with the Hormone Dietitian. Well, welcome, Melissa.
Welcome.
Thank you so much for having me. I'm so excited to chat with you.
Oh my goodness. Well, we are equally as excited to have you here. So we're going to just go ahead and ask you a few questions, Melissa, if you don't mind. Dr. Gold and I are going to go back and forth with a few questions. But first of all, can you tell us a little bit about your background and really what inspired you to become the hormone dietitian?
Yeah, it's a little bit of a complicated journey. I went to school for English and dance. So I have a BA in English and dance and ended up working in pharmaceutical advertising in New York City, which I know even that is already a bit of a jump. And I didn't realize how much I liked science when I was in school because I was always, going down the English, literature, arts kind of path and had pretty little exposure to science, but I picked up medical terms and scientific concepts really easily. And so in the world of pharmaceutical advertising, I ended up working on the most high science launch medications. So I was working exclusively in oncology, which, again, how did I get to where I am from there? If you know anything about the world of New York City advertising, it's kind of what you would expect. It's very, very busy. It's nonstop. It's 90-hour weeks. It's living out of a suitcase. And I just, I got to the point in my career, I was 35. I was a vice president, associate creative director, and I was burnt out and I was tired of how much my job was affecting my life and my health, my physical and mental and emotional health. And so I started to think, okay, well, what am I interested in? What's my escape plan here? And, I'm staring at the 4 bookshelves of nutrition and cookbooks and food politics books. And I was like, I wonder what it would take. And so it took me 7 years to, go back to school, get the degree in nutrition, do the dietetic internship, pass the board exam, and start working as a dietitian. Even up to that point, you don't get a lot of education on women's health other than, some pretty basic life cycle nutrition through pregnancy. And, that's about the extent of the women's health education you get. And so really it was the first client that I had who had PCOS where I was talking to her and, sort of the advice she'd been given and the recommendations she'd been given. And I was like, let me dig into this a little more because I think we can do better for you. I think on the one hand, women with PCOS are kind of being told here, take the pill, come back when you're ready to get pregnant. it's much more than just a reproductive condition. On the other hand, they're turning to maybe alternative health practitioners who are telling them, cut out sugar and carbs and gluten and dairy and soy and all of your favorite foods for the rest of your life. And so I really sort of developed my own sustainable methods to working with people with PCOS. And it's been really great. I mean, it's such a rewarding population to work with because it's really just, tiny little changes and we can get ovulation back, regular cycles back for most of them. And most of them are desperate to get regular periods. And you don't know what it's like to be desperate for a period until you, have gone months and months and years without one. So, it's been a really wonderful, rewarding population to work with.
It sounds fantastic. It really, really does.
Again, I agree with you, Dr. Gold, that what a wonderful journey you have taken these women on through, desperation into revelation and also what their options are. Thank you so much, Melissa, for sharing that with us.
So I'm a breast cancer surgeon, right? But we see ladies with all kinds of breast problems, right? Through all phases of their life. And in a similar way, I get referred ladies who have benign breast problems in their youth. And a lot of times what I see is similar to your experience. They're having period irregularities, maybe not necessarily PCOS or PCOS that is possibly undiagnosed, and they're put on the pill. And then they have more problems, and then they get benign growths in their breasts, and then they keep, getting more. And I'm sort of left like, I don't want to take you off your birth control pills, but like, isn't there something else? So I've had that exact thought. So if you wouldn't mind sharing, how exactly does traditional medicine fail women when it comes to treating hormone imbalances?
Yeah, I think, I'm definitely not here to bash birth control pills by any means. I myself was on them for a very long time. I think it's a very effective form of contraception, which is, even more important to consider now. Having an effective form of contraception. I think it's been really kind of treated as a treatment or a cure-all for all women's ailments. If you have heavy periods, take the pill. If you have acne, take the pill. If you have irregular cycles, take the pill. And so, when I'm working with a client who's on the pill, I'm always asking them why they went on in the first place. Because if it was for any reason other than contraception, chances are that problem is still there and the pill is just covering it up. So that's really where, when we're working and, what you were describing, Dr. Lindsay, is much more in line with my own personal hormone struggles. I don't have PCOS myself, actually, which I think a lot of people are surprised by, but that was always my history was the heavy periods. What do I have? I have microcalcifications in the left breast and the little tag in there. And, that every 6 months mammograms for a while, starting at 35. So I've definitely been down that road before. On some level that helps me relate to my clients, even though the particular hormone issues we're struggling with are slightly different. But there are other things we can do. I'm really, especially when it comes to the estrogen. And, I think recently, I don't know if you saw it, but a sort of prominent functional medicine doctor described PCOS as a condition of estrogen dominance, which it's really not. But there are situations where people do have high estrogen in comparison to progesterone, or, with PCOS, the problem is really the unopposed estrogen because they're not ovulating regularly. So they're not getting that regular exposure to progesterone that balances the estrogen out. So when we're looking at, estrogen problems and estrogen driven problems, we're looking at what the literature says can support estrogen metabolism. So good general liver health, things like cruciferous vegetables and berries and citrus fruits. We're looking at increasing fiber. People who eat more fiber have lower estrogen levels. Looking at exercise, amount of exercise has, an inverse relationship to estrogen levels. So, it's hard because it's not a one size fits all. Everyone needs to exercise more or everyone needs to eat more broccoli, but it's looking at an individual situation and determining which of those strategies might make sense for them.
That's so fascinating. When you are evaluating a client with, specific complaints, does this require blood work to adjust the recommendations, or is it just, a good history, asking the right questions? How does the approach to the patient's problem, sort of from your clinical perspective, how does that work?
Yeah, it's a combination of both, a really good medical history, from a functional medicine history, we're looking all the way back to childhood. I'm asking them things like, were you born vaginally or by C-section? How many times were you on antibiotics as a kid? Because that's going to impact your gut microbiome. Were you breastfed or not? Things like that. And then a full nutrition assessment where I'm asking about their typical diet and, are there any foods they avoid and why? There are people who, for example, don't like fish. They never eat fish or, live near a coast. So it's just not part of their regular diet. So we're looking at that. And then I'm looking at whatever labs they do have and then, ordering anything that they might be missing. For example, like one, I would say a really common hormonal symptom that a lot of people, that drives people to come to a dietitian would be something like hair loss. Their hair is thinning. And so, you'll see people taking large amounts of biotin thinking that's the answer. And that's almost never the answer. I'm wondering, is it iron deficiency or zinc deficiency? Is it high cortisol? Is it low thyroid? Have you had a COVID infection in the last 6 months? Like what's going on that the hair is falling out? And then the hormonal changes. Are you nearing perimenopause? Are you, were you recently postpartum or did you have a miscarriage? All of those things that can cause estrogen to drop. So yeah, we're really looking at what's the root cause of the symptom that's bringing you in, because that's going to determine what the course of action is.
That is fascinating. In breast cancer, we obviously are treating women and we'd like them to live like long and fruitful lives with great quality of life. And of course, we give them medication for the purposes of reducing the risk of recurrence. And then for many, that substantially decreases their quality of life because we put them in a low or no estrogen state. Mm-hmm. And is there anything that patients could do from a functional medicine standpoint to offset some of the side effects of those, necessary medications?
Yeah, that's where it gets kind of tricky. Medications will limit the amount of strategies that we could use. We could do different things before you were on like a hormone blocker or something like that. But yeah, that sudden surgical menopause or something like Femara, that's going to put you in menopause. I wouldn't want to use some of the strategies I might use to raise estrogen in someone who we don't want to raise estrogen in,
yes, I see.
We're tanking their estrogen on purpose after mm-hmm. breast cancer. That being said, there are some things we can do, and it really depends what their doctor feels comfortable with. Phytoestrogens, for example, they are plant estrogen-like compounds that bind to the estrogen receptors. So sometimes, like in perimenopause and menopause, phytoestrogens can help alleviate symptoms because they are binding to those same receptors and sending a much weaker signal. They don't raise estrogen, but I think it would depend on what the patient's practitioner was comfortable with in terms of phytoestrogens can be a little controversial.
Sure. And if our diet can help raise our estrogen level, can changes in the diet decrease estrogen levels in the same way? Because again, these side effects of these medications are quite significant, to the effect that up to 40% of women on clinical trials will just discontinue them. And of course, that's not good at all. So even in the population who couldn't tolerate them, if we were able to learn and counsel them on how to maybe decrease estrogen levels, even, through diet, that would be helpful, right? It's better than doing nothing. Is that a possibility?
Yeah, it's actually much more effective than the other way around. You can't really raise estrogen with diet. You can alleviate symptoms with things like phytoestrogens, but you can lower estrogen with diet. And, that may look different for different people. It generally involves a very plant-forward approach, lots and lots of plant protein and plant fiber. And again, the research really supports that the people who eat the highest amounts of fiber have the lowest amounts of estrogen. And same thing with exercise. I believe it's every 10 minutes of exercise, cardio exercise, estrogen levels can decrease by 10 points. The recommendations in the studies is 300 minutes of cardio a week for high estrogen levels. And I think that's a lot, definitely a lot for someone coming out of cancer treatment who's maybe also struggling with fatigue. So, we really have to look at the big picture. But it is possible to lower estrogen levels. Things like soluble fiber, flaxseed, oats that help bind to excess estrogen in the colon and make sure that it leaves the body. We want to make sure that they are having a bowel movement daily to sweep that estrogen out daily so it can't recirculate in a more toxic form. So yeah, there are definitely strategies to help.
That's great news. I mean, really, really great news for our listeners who are going to be interested in that as it relates to their breasts. That's excellent. Excellent advice. Thank you.
I think another thing that I wanted to mention is, and I don't think it gets talked about enough, but the hormone disruptors in our environment are really contributing to some of the hormone imbalances and the fertility issues that we're seeing. So that's, almost more important than the food piece of things in terms of lowering exposure to estrogens. And I'm not one of those, throw away all of your beauty products and buy all new things. But I think, simply swapping out the plastic in your kitchen for glass or stainless steel, anything that touches your food, that's going to make a huge difference.
Okay. Thank you so much, Melissa. I appreciate that. Now, Melissa, you have an offering called the Period Problems Root Cause Roadmap. Can you tell us more about that course and who it's designed to help?
Yeah, that course is designed to help more the type of women that we've been talking about, maybe women who've been struggling with hormone imbalance symptoms all their life, things like heavy periods, fibrocystic breasts, polyps, fibroids, all of those things that can come from high estrogen levels. And what it is it's a 8-week course where we go through the root causes of hormone imbalances. I think a lot of people think that hormone imbalances are the problem themselves, but hormones don't become imbalanced by themselves. Hormone imbalances are a sign that something's imbalanced elsewhere in the body. So we're looking at things like diet and lifestyle. We're looking at liver health, gut health, hypothalamic, pituitary, ovarian, adrenal, and thyroid axis function. And, just talking through where the problems can happen. Estrogen dominance. A lot of people think they are estrogen dominant, but is it because estrogen's high and progesterone's low? Is estrogen normal, but progesterone's low? Or there are so many ways that one could be estrogen dominant, quote unquote. It's just an imbalance, but it's representative of something elsewhere in the body.
And do men have these type of issues as well? Because they too have similar hormones, but just in different levels, right?
Yeah, I always joke that for men, it's every day is like Groundhog Day because their hormones their hormones are on 24-hour cycles. So every day is the same. Whereas women, I think we want to feel the same over the course of the month, but most of us do not. We'll tend to feel sluggish during our period as we're losing blood. We're tired. We'll feel energized as we're approaching ovulation. And then we'll kind of have a calmer, more introspective luteal phase as progesterone's rising. It's just, our hormones are different over the course of ideally a 28-day cycle. So, I think I actually recently, it was this week, actually, I was working with a client who one of the issues she was having was that her libido was dropping after ovulation. And I had to explain to her that that's normal. That's actually, it's supposed to be higher before ovulation and then drop off after ovulation. That's actually a very normal pattern to have. So yeah, it's about, learning how to tune into your body and live your life in a way that promotes hormone balance.
Thank you, Melissa. And do you have a favorite success story of a client you helped? You helped address their hormone imbalance.
So I had a client who came to me and I was her sort of last ditch effort. She had secondary infertility. So she had a daughter who was about 5 years old. Her OBGYN had put her on Clomid to try to get her to ovulate for a second child. She did 3 rounds of Clomid and failed. So she did have a PCOS diagnosis. And the next step was she was scheduled for ovarian wedge resection surgery, which, it sounds pretty barbaric, but that's what the guidelines recommend after 3 failures of Clomid. And so, sort of last ditch, come to me, see, if I can help her figure out what's going on. So I got her, we do the really thorough, assessment interview. I'm talking to her about her diet. She hadn't even mentioned any gut issues when we had spoken previously. And she just had a ton of gut issues. So she was constipated. She was only having a bowel movement like twice a week. It turned out she was eating 8 to 10 mini meals a day, little snacks. So she would use food as a reward, and she was not overweight. She was, normal weight, but she would use food as a reward. So she would have her 9 a.m. meeting and then have, a granola bar. And then she'd have her 10 a.m. meeting and she'd have a little bowl of oatmeal, and she'd have her 11, she'd just do that throughout the course of the day. And so, I instantly got her working more on, promoting good gut health. Slowing down, chewing her meals, eating mindfully, spreading her meals out and eating more balanced meals. Ordered some labs for her that I felt we were missing. Got the labs back, and all of her estrogen was low, her testosterone was low, her DHEA was low. And so I'm not really sure what removing portions of her ovaries would have done for this client other than make her hormones even lower. So we, continued working on that. We worked on stress. We worked on sleep primarily. And she ended up getting pregnant and being able to call the doctor and say, cancel my surgery. I'm pregnant. So yeah, that's probably one of the most impressive ones. But I just feel like, it's such a huge surgery and such a huge decision to be making, and to be doing it without having complete information about what your hormones are doing. And if the simple fix was stop eating 8 to 10 times a day and sit down and eat 3 solid meals, Like how easy is that?
Right, right. And part of the problem, as I'm sure you know, is in medical training, there is no education in nutrition. So if everything, if all you have is a hammer, then everything's a nail and it's all and it's a real detriment to healthcare providers that we don't get that information. I suspect that's how functional medicine was born in itself, was people looking to say, hey, wait a minute, what are we missing here?
Yeah, I am seeing more and more conventional medical doctors going down sort of a, not necessarily functional, but a lifestyle medicine sort of approach where, we're looking at the whole person. We're not treating conditions. But yeah, I mean, on the other hand, dietitians, essentially we do pre-med -1 chemistry course plus
Right.
all of the nutrition education. And, it's actually changing. It's starting in 2024. Dietitians will require a master's, as sort of baseline.
Wow.
Mm-hmm.
Yeah. They need to have dietitians come and teach, a semester or something in traditional medical school. So we can learn from you, because we're not helpful to our patients if, medicine is the first line and then surgery is the second or third line. It's not really helpful to anybody. So what I see in my practice, patients are pushing back on this. They don't want medication as the first answer to their problem or whatever. They're saying, well, wait a minute, isn't there something else I can do? I mean, I hear this every day, all day long. And it's tough. So I seek out information. That's part of how this podcast became, is trying to seek out information to the answers that my patients have, which are, people like you. So if I were to need to, so if one of our listeners was to need to want to get in touch with you and maybe have a consult, what would be the best way for them to do that?
Yeah, my website is really the best way to know what I have available at the time. thehormonedietitian.com. And yeah, I definitely, just to echo what you were saying, have really good relationships with doctors, multiple doctors. Referring to a dietitian is so important. I think a lot of times, we can get into the habit of, oh, I'm just going to give this person a handout and tell them to follow this diet. And we would always so much rather have patients referred to us, because
Sure.
We do have that experience, just the nutritional biochemical knowledge, and checking for any supplement interactions against medications. I'm sure you see a lot of supplements in your as well. So I'm always checking those against what medications a patient's taking, because it's so, so important.
Yeah. Yeah. I mean, if it was as easy, if the problem was easy enough to solve with a handout, you wouldn't have a job. So clearly it's not. So thank goodness. But there are people around like you, or maybe if you're the best in your field, which it kind of sounds like, that I'm super excited to have been able to connect with you and have all the listeners hear what you have to say and be able to contact you. In the back of my mind, I'm thinking to myself, I'm going to put myself on that list. I got a whole list of issues I could come talk to you about.
Yeah, I have a lot of doctors who actually keep my cookbook in their office for their PCOS patients as well. But yeah, that's, similar to the medical field. A lot of us specialize, I not that I don't know, we studied nutrition, all of the aspects of nutrition in school, but if I needed a dietitian for chronic kidney disease or something, I would refer to a colleague who specializes in that, because there's just, there's so much research to keep up on. So only so much time to do.
Oh, absolutely. Well, like in the hospital, right? As a surgical resident, we are simply exposed to, the
everything,
parenteral nutrition. And that's a whole other, like a whole other ball game that is, super complex in its own right. When the gut can't be used. I mean, I love the gut. That's a whole other podcast. The gut is the best. But, every now and then it can't be used. And then you're really that's a real struggle. So yes, definitely. I love how all aspects of healthcare becoming specialized, which is really wonderful because the knowledge is advancing. Of course, a little more difficult for patients. Long gone is the one-stop shopping where you can go to your family doctor and have all your problems answered. It just doesn't exist anymore.
Mm-hmm.
Melissa, do you have a special offer for our listeners?
We do have the quiz. I have a Find Your PCOS Root Cause quiz to get you sort of thinking about, what that root cause may be. And it's fun. You get to answer questions about what kind of foods you crave and what some of your symptoms are. And that's right on my website, right at the top of my website. So people can take that. I'm most active on Instagram. So almost every day posting content over there as well. And that's the same. It's the.hormone.dietitian.
Wonderful. Well, thank you so much, Melissa. And thank you, Dr. Gold, for joining us in this lively conversation tonight about hormone imbalances, fertility, PCOS, and nutrition. I want to thank you both for joining us this evening.